testing your understanding of autonomy, implied consent, and beneficence. Includes 4 options and clear explanations. Clinical vignette, emergency treatment without consent. A 60-year-old man is brought to the emergency room unconscious after a car accident. He has massive internal bleeding and requires immediate surgery to survive. There is no family present, and the patient is unable to give consent. The medical team does not have access to his advance directives or medical records. What is the most appropriate next step? A. Wait for a family member to arrive and give informed consent. B. Proceed with surgery under the principle of implied consent. C. Delay treatment until the patient regains consciousness. D. Avoid surgery due to lack of explicit consent. Correct answer, B. Proceed with surgery under the principle of implied consent. Explanee, proceed with surgery under the principle of implied consent. In emergency situations where a patient cannot provide consent and delay would result in serious harm or death, the law and ethics permit treatment based on implied consent. It is assumed a reasonable person would consent to life-saving care. Why not the others? A. Wait for a family member to arrive. Delaying treatment in a life-threatening emergency violates non-maleficence and beneficence. Time is critical. C. Delay treatment until the patient regains consciousness. The patient may not regain consciousness in time. This option endangers the patient's life and violates ethical duty. D. Avoid surgery due to lack of explicit consent. This reflects a misunderstanding of emergency care exceptions. Explicit consent is not required in emergencies where the patient is incapacitated. Key principle: in emergencies, physicians may provide life-saving treatment without explicit consent under the principle of implied consent, assuming the patient would have consented if able. Want one next?